When should I seek emergency care if I am a COVID patient under home isolation? And what is the recovering time for the COVID disease?
For a COVID patient who's under home isolation, what we have said earlier is very important. He has to self-monitor first. Okay, he has disease. He has COVID-19. So what we do is we give them a small booklet where they record their temperatures, their any symptoms, anything, even SpO2 if they are visited by an ASHA or something like that. Okay, so that booklet is important. Okay, otherwise, those who have their own, some patients, what happen nowadays, patients are buying their own pulse oximeter and all. They can do monitoring by themselves, or they can buy their own thermometer to monitor their temperature. What is important is self-monitoring. Okay, in case they feel that they are not feeling well, they are not feeling normal, let's say, more than usual, what they can do is they can contact the healthcare authorities who are in charge of that area. They can contact them, this healthcare, the doctors, the ASHAs, the ANM of that area will come and visit the patient, and they'll assess whether the patient really needs to be at home or has to be taken care in an institution. So the advice is actually self-monitoring and prompt informing the healthcare authorities of that area about your symptoms. If you develop symptoms, new symptoms and all, which are might be more serious than what you had earlier. Okay, so that is what a home isolation patient should do. He should have the number of the healthcare authority or the nurse or the ANM ready so that they can contact them anytime. Okay, in case that is not possible, they can always call 108. They can call 108. They can say that I am a COVID patient. This is my third day, fourth day, fifth day, or whatever day it is, and I'm having difficulty in breathing, or I'm having chest pain, or I'm having very high fever. It's not being controlled with paracetamol. Suppose means they can say all those things to the 108 team. The 108 team will come and pick them up and then take them to a COVID hospital or to any hospital which can deal with a COVID patient. Okay, so that is number one. Now, regarding the recovering time for COVID disease, say earlier when COVID just started, that time there was not much data. So those times what we did was 14 days isolation in an institution and then another 14 days at home. Then as time passed by, the protocol kept on changing. So now the latest data, according to Western countries, even ICMR also had a study, I think. So they say that by 10 days after symptoms onset, after the patient had symptoms for the first time, most of the patients have recovered. Okay, so those are for either mild symptoms or moderate symptoms. For severe patients with severe disease, those who are in hospital, the recovery is there is no timeline actually. It depends on the response of the patient to the treatment. So we say that a patient has recovered only if after giving treatment and after giving oxygen, after doing what you say, if we are doing ventilation or something like that, any intervention, let's say, okay, and the patient has had no symptoms for the last 72 hours, means the fever, as I said, that the difficulty in breathing has become normal again, means no difficulty in breathing again. So for severe patients, even for moderate also, some subset of moderate patients, if they have been if they have had no symptoms in the last 72 hours, then we can consider them as recovered. Okay, what one thing what we can do in severe patients also, what we are actually, some of us are still doing, though it's not done everywhere, is for those patients we retest them to see whether the virus has cleared or not.
Together, we shall overcome. Let's be responsible citizens.